You take it every morning. Your doctor prescribed it. Your insurance covers it. And according to new research published in the Journal of the American Heart Association, it might be doing more than lowering your blood pressure. Studies are now revealing that one of the most commonly prescribed classes of antihypertensive medications is linked to a cascade of metabolic changes that millions of people never saw coming. The mechanism isn't obvious, the symptoms develop slowly, and by the time most people connect the dots, they've been on the drug for years. What makes this even more complicated is that these medications work exactly as intended for blood pressure, but what's happening beneath the surface involves your blood sugar, your kidneys, your electrolyte balance, and even your risk of developing a completely separate chronic condition. We're going to walk through 5 things this drug class does to your body that your doctor may not have discussed during that 10-minute appointment. And the 5th one is still being studied, but the preliminary data is unsettling enough that cardiologists are starting to rethink long-term prescribing protocols. If managing blood pressure feels like only part of the equation, that's because it is. The real challenge is protecting your cardiovascular and metabolic health simultaneously over the next decade. There's a multi-phase approach in the description that addresses blood pressure control alongside blood sugar stability, kidney function support, and electrolyte rebalancing. It covers daily routines, supplement timing, and meal strategies based on what works for people over 60 managing both hypertension and prediabetes. The link is in the description below or pinned at the top of the comments. Before we get into the specifics, you need to understand what thiazide diuretics actually do inside your body. These drugs, hydrochlorothiazide and chlorthalidone, are the most common, lower blood pressure by forcing your kidneys to expel more sodium and water. Less fluid in your bloodstream means less pressure against your artery walls. Simple physics. It's why thiazides have been a first-line treatment for hypertension since the 1950s. But here's what the mechanism doesn't account for. Your kidneys don't just filter out sodium and water. They regulate a delicate balance of electrolytes, glucose reabsorption, insulin sensitivity, and uric acid clearance. When you chemically override one part of that system, the rest has to adapt. Research published in Diabetes Care followed over 12,000 patients on thiazide therapy for more than 6 years and found significant shifts in fasting glucose levels, hemoglobin A1C, and new diagnoses of type 2 diabetes compared to patients on other blood pressure medications. The study controlled for age, weight, and baseline metabolic health. The difference wasn't marginal. Another analysis in Hypertension Journal examined kidney function markers and found that long-term thiazide use correlated with reduced glomerular filtration rates in a subset of patients, particularly those over 65. Your body is interconnected. A drug that changes how your kidneys handle sodium will inevitably change how they handle everything else. What follows isn't a list of side effects you can ignore. These are physiological consequences that compound over time, and most people don't realize they're happening until lab work starts coming back abnormal. The first thing thiazide diuretics do is raise your blood sugar, not dramatically, not overnight, but steadily, quietly, and often unnoticed until you're sitting in your doctor's office being told your A1C has crept into pre-diabetic range. The mechanism starts in your pancreas. Thiazides reduce potassium levels in your blood, and low potassium impairs insulin secretion. When your pancreatic beta cells don't have enough potassium, they can't release insulin efficiently, even when your blood sugar is elevated. At the same time, these drugs appear to increase insulin resistance in peripheral tissues, meaning the insulin you do produce becomes less effective at moving glucose into your cells. A meta-analysis in The Lancet reviewed data from over 76,000 patients and found that people on thiazide therapy had a 15% higher risk of developing new-onset diabetes compared to those on ACE inhibitors or calcium channel blockers. 15% might not sound catastrophic, but when you're talking about millions of prescriptions written every year, that translates to tens of thousands of people crossing into a second chronic disease they didn't have before. The insidious part is how gradual this is. You don't wake up with diabetes, you notice you're a little more tired, you're thirstier than usual, your fasting glucose goes from 95 to 102 to 108 over the course of 18 months. Your doctor adjusts your medication or adds metformin, and suddenly you're managing 2 conditions instead of 1. If you've been on hydrochlorothiazide for more than 2 years and your fasting blood sugar has climbed even 10 points, this isn't coincidence. It's pharmacology. And it raises a question most patients never get to ask. Is controlling my blood pressure worth destabilizing my blood sugar? The second issue is potassium depletion, and it's more serious than most people realize. Thiazides force your kidneys to excrete potassium along with sodium. Potassium is critical for heart rhythm, muscle contraction, nerve signaling, and cellular energy production. When your potassium drops below normal range, a condition called hypokalemia, your heart becomes electrically unstable. Studies in the American Journal of Cardiology have linked chronic low potassium to an increased risk of arrhythmias, particularly atrial fibrillation and ventricular ectopy. Your heart depends on a precise balance of sodium and potassium to maintain its rhythm. Disrupt that balance, and you create the conditions for irregular beats, palpitations, and in severe cases, life-threatening arrhythmias. Beyond the heart, low potassium affects your muscles. You feel weak. You cramp easily, especially at night. Your legs feel heavy. Some people develop a persistent muscle fatigue that doesn't respond to rest or hydration. This isn't aging. This is electrolyte imbalance. A study published in Hypertension followed patients on thiazide monotherapy and found that nearly 30% developed clinically significant hyperkalemia within the first year, and most were never told to monitor their potassium levels or adjust their diet. The standard response is to prescribe a potassium supplement or switch to a potassium-sparing diuretic, but that's reactive, not preventive. The damage to your heart rhythm and muscle function can begin long before your potassium drops low enough to trigger a lab flag. If you've noticed new muscle cramps, unexplained fatigue, or occasional palpitations since starting your blood pressure medication, check your last metabolic panel. Look at your potassium. If it's sitting at the low end of normal or just below, you're already feeling the effects. Third, thiazides increase uric acid levels, and that opens the door to gout and kidney stones. Uric acid is a byproduct of purine metabolism, and your kidneys are supposed to filter it out. Thiazides interfere with that process. They reduce uric acid excretion, causing it to accumulate in your bloodstream. When uric acid levels rise high enough, it crystallizes in your joints, most commonly your big toe, but also your ankles, knees, and fingers. That's gout. The pain is excruciating. The inflammation is severe. And once you've had one gout attack, you're significantly more likely to have another. Research in arthritis and rheumatology examined the relationship between diuretic use and gout incidence and found that people on thiazide therapy had more than double the risk of developing gout compared to those not on diuretics. The risk was dose-dependent. Higher doses meant higher uric acid and more frequent attacks. But gout isn't the only consequence. Elevated uric acid also increases your risk of kidney stones, particularly calcium oxalate stones, which form more readily in acidic, concentrated urine. A study in the Clinical Journal of the American Society of Nephrology found that long-term thiazide users had a 40% higher incidence of nephrolithiasis, kidney stones, compared to patients on alternative antihypertensives. Passing a kidney stone is not a minor event. It's intensely painful, often requires medical intervention, and increases your risk of chronic kidney disease if stones recur. If you've been on a thiazide for several years and you suddenly develop joint pain in your foot or experience sharp flank pain that radiates to your groin, this isn't bad luck. It's a known, predictable consequence of how these drugs alter your kidney's ability to manage uric acid. Most people are never warned. The fourth thing is kidney function decline, and this one is particularly troubling for older adults. Thiazides are supposed to help your kidneys by reducing the volume load they have to filter, but in practice, long-term use can paradoxically reduce your glomerular filtration rate, the measure of how well your kidneys are cleaning your blood. A longitudinal study published in the Journal of the American Society of Nephrology tracked kidney function in patients over 65 on thiazide diuretics for more than 5 years. The researchers found a gradual but consistent decline in eGFR, estimated glomerular filtration rate, particularly in patients who were also taking NSAIDs or had baseline kidney impairment. The mechanism involves reduced blood flow to the kidneys. Thiazides lower blood volume, which lowers blood pressure, but if that drop is too aggressive or sustained, your kidneys don't get enough perfusion to function optimally. Over time, this can lead to chronic kidney disease, a condition that's irreversible and progressive. The scary part is how silent this is. You don't feel your eGFR dropping from 75 to 60 to 55. You don't have symptoms until you're well into stage 3 chronic kidney disease, and by then, the damage is done. Another concern is the interaction between thiazides and other common medications. If you're taking ibuprofen for arthritis or naproxen for back pain, you're compounding the stress on your kidneys. NSAIDs reduce blood flow to the kidneys on their own. Combine that with a diuretic, and you've created a perfect storm for acute kidney injury or accelerated chronic decline. If your most recent labs show your eGFR has dropped more than 10 points over the past 2 years, and you're on a thiazide, this needs to be a conversation with your doctor. Kidney function doesn't come back. The fifth and most unsettling finding is the potential link between long-term thiazide use and cognitive decline. This research is still emerging, but the data is compelling enough that it's being discussed at cardiology and neurology conferences. A study published in Neurology followed nearly 10,000 older adults for over a decade and examined the association between different classes of blood pressure medications and the risk of developing dementia. The results showed that patients on thiazide diuretics had a slightly elevated risk of cognitive impairment compared to those on ACE inhibitors or ARBs. The suspected mechanism involves chronic electrolyte imbalances, particularly sodium and potassium, which affect neuronal function and brain cell hydration. Your brain is exquisitely sensitive to shifts in the electrolyte balance. Even mild chronic hyponatremia, low sodium, has been linked to confusion, memory problems, and increased fall risk in older adults. Thiazides can cause hyponatremia, especially in people over 70, and especially in the first few weeks of treatment or after a dose increase. But the cognitive effects may not be limited to acute electrolyte drops. Some researchers hypothesize that long-term diuretic use may subtly impair cerebral blood flow or disrupt the blood-brain barrier's ability to regulate fluid balance. Another study in the Journal of Alzheimer's Disease found that patients on thiazides who also had poorly controlled blood sugar, remember, thiazides raise blood sugar, had an even higher risk of cognitive decline, suggesting a synergistic effect between metabolic dysfunction and medication side effects. This isn't definitive. The research hasn't reached the point where guidelines have changed, but if you're over 65 on a thiazide and you've noticed that your memory isn't as sharp, that you're more forgetful, or that you feel mentally foggy more often than you used to, this is worth investigating. Cognitive decline is not an inevitable part of aging, and it's certainly not something you should accept as a side effect of blood pressure management. So what do you do if you're on a thiazide and this information has you concerned? First, don't stop your medication without talking to your doctor. Abruptly discontinuing a blood pressure drug can cause rebound hypertension and increase your risk of stroke or heart attack. But you absolutely can have a conversation about alternatives. ACE inhibitors, ARBs, and calcium channel blockers are all effective at lowering blood pressure and don't carry the same metabolic risks. Some of them even have protective effects on kidney function and blood sugar. If your doctor insists on keeping you on a thiazide, ask about the lowest effective dose and request regular monitoring of your potassium, sodium, fasting glucose, uric acid, and kidney function. These aren't optional labs. They're essential if you're going to stay on this class of drug long term. Second, Consider adding potassium-rich foods to your diet if your levels are borderline. Bananas, avocados, spinach, sweet potatoes, and white beans are all excellent sources. Some people benefit from a potassium supplement, but that should be done under medical supervision because too much potassium can be just as dangerous as too little. Third, if you're noticing blood sugar creep, tighten up your carbohydrate intake and increase your physical activity. Thiazides make insulin resistance worse, but exercise improves it. Even 30 minutes of walking most days can counteract some of the metabolic effects. Fourth, stay hydrated, but don't overdo it. Thiazides make you urinate more, and dehydration worsens electrolyte imbalances. But drinking excessive amounts of water can dilute your sodium even further and make hyponatremia worse. Find a balance. Fifth, if you have a history of gout or kidney stones, talk to your doctor about whether a thiazide is the right choice for you. There are other options that don't elevate uric acid. Let's recap. First, thiazide diuretics raise blood sugar by impairing insulin secretion and increasing insulin resistance, putting you at higher risk for prediabetes and type 2 diabetes. Second, they deplete potassium, which destabilizes your heart rhythm and causes muscle weakness and cramping. Third, they increase uric acid levels, significantly raising your risk of gout and kidney stones. Fourth, long-term use can reduce kidney function and accelerate chronic kidney disease, especially in older adults or people taking NSAIDs. Fifth, emerging research suggests a potential link between thiazide use and cognitive decline, possibly due to chronic electrolyte imbalances and metabolic dysfunction. These aren't rare side effects. These are predictable physiological consequences that happen to a significant percentage of people who take these drugs for years. The point isn't to demonize thiazides. They've saved lives. They've prevented strokes. But the conversation around them has been incomplete. You deserve to know what else is happening in your body when you take this medication every single day. If your blood pressure is controlled, but your blood sugar is climbing, your potassium is low, or your kidney function is slipping, those aren't separate problems. They're connected. Now that you see how these drugs affect your metabolism, kidney function, and electrolyte balance, the real question is how to manage blood pressure without triggering these secondary issues, or how to reverse them if they've already started. There's a detailed protocol in the description that walks through the full picture. Medication alternatives your doctor might not have mentioned, supplement timing for potassium and magnesium support, meal strategies that stabilize both blood pressure and blood sugar, and the daily routines that protect kidney function long-term, built specifically for people over 50 managing hypertension. The link is in the description below or pinned at the top of the comments. Your blood pressure medication should make you healthier, not trade one chronic disease for another.